Hello, I'm Lance Liberti, President and CEO of Integrative Practice Solutions in Juventak's Regenerative Medicine. I've worked with many of you on implementing regenerative medicine protocols into the practice for people with degenerative disc disease, degenerative joint disease, peripheral neuropathy, and other conditions of aging that affect the elderly population and restrict people from their daily activities and recreational activities. We all know the science behind what we do and the clinical efficacy of what we do is very high. But educating a patient and getting them to a point where they're ready to accept those techniques and, most importantly, pay for those techniques that are not yet covered by insurance can be an obstacle to success. One of the ways that we recommend getting new patients into the practice for these revolutionary techniques is through live presentation with lunch and learns or dinner workshop presentations. But not everybody is a naturally born public speaker. So what happens when you want to bring the word to your community, get more patients in for this type of a technique, but you don't know how to do a stage show effectively? And that's where my godfather and industry legend, Dr. David Singer, comes in. Probably one of the best stage presenters I've ever met in my life. He was selling people from stage back when you had overhead sheets that you had to draw on and slide carousels that went click-clunk every time you changed them. And he was the best back then and he's the best today, except with some new technology at his disposal. So if you're attempting to do lunch and learn workshops or dinner presentations and your close rate isn't what you want it to be, I highly recommend Dr. Singer's training techniques. They have intensive sales mastery courses on how to do one-on-one closings inside the practice, but a very effective seminar on how to do that stage show more effectively. And we know through our advertising agency that bringing patients into those type of settings, in a neutral setting, with a meal, is a very good way to get the patient in because they don't feel like they're going to be sold. It's a neutral ground. But then it's up to you to educate them and motivate them to a point where they want to come in and do that consultation and evaluation. I know that's where a lot of people fall short. So I highly recommend you look into attending a free web presentation or consultation with Dr. Singer and his team to give you some pearls of wisdom on how you can increase those stage shows, and then obviously speak with us about how to fill the room with the people for those presentations. Thank you very much.